Welcome, future nurses. Today, we're diving into geriatric nursing, a specialized and increasingly important field within healthcare. This area is vital not only for your NCLEX preparation, but also for the trajectory of your nursing career. Our population is aging significantly, and as a result, you'll inevitably be caring for more older adults than ever before in your professional practice. This makes geriatric nursing skills absolutely essential. Geriatric nursing isn't just about memorizing facts to pass a test. It's fundamentally about providing unwavering dignity, respect, and compassionate care to every patient, recognizing their unique life experiences and contributions. Older adults often have very unique and complex needs and challenges, ranging from chronic illnesses to mobility issues. Understanding these specific needs is absolutely key to providing excellent, patient-centered care that promotes well-being and independence. The NCLEX will frequently test your ability to think critically and apply your knowledge about complex, multifaceted health issues that are commonly encountered in the older adult population. Mastering the principles of geriatric care builds a strong and versatile foundation for your entire nursing journey, regardless of your chosen specialty. We'll break down complex topics like dementia, delirium, depression, sundowning, and the sensitive subject of end-of-life care into clear, manageable concepts that you can easily understand and apply. Think of this module as your comprehensive roadmap, guiding you towards providing confident, compassionate, and effective care for older adults. Your dedication to learning these principles now will undoubtedly lead to improved outcomes and a higher quality of life for your future patients. Our primary goal is to empower you with the knowledge and skills necessary to confidently walk into the NCLEX and to embark on your nursing career fully prepared and brimming with confidence. Remember, the care you provide has the power to impact not just their physical health, but also their overall quality of life, their sense of dignity, and their emotional well-being. Every skill you learn and every concept you master is a valuable tool that enables you to effectively advocate for your patients' rights and needs. So let's begin this enriching journey together and thoroughly prepare you for both the unique challenges and the profound rewards that come with specializing in geriatric nursing. In geriatric nursing, three conditions often present unique challenges and can sometimes be difficult to differentiate. These conditions often overlap: dementia, delirium, and depression. Understanding the nuances of each is essential for providing optimal care to our older adult patients. Dementia is a gradual, irreversible decline in memory and thinking. It's a syndrome characterized by a persistent disruption of mental processes. Alzheimer's is the most common type. It accounts for a significant percentage of dementia cases, and its impact on individuals and families is substantial. Alzheimer's disease is characterized by three key features: the presence of amyloid plaques, neurofibrillary tangles, and structural damage to the brain known as atrophy. Amyloid plaques are abnormal protein deposits that disrupt cell communication. Neurofibrillary tangles are twisted fibers inside brain cells, interfering with their function. Brain atrophy refers to the shrinking of brain tissue, which worsens as the disease progresses. The exact cause of Alzheimer's is not fully understood, but risk factors include advanced age, family history, genetics, head injuries, and conditions like hypertension and diabetes. Diagnosis involves clinical assessment, cognitive testing, brain imaging, and sometimes laboratory tests to rule out other causes. Other causes of dementia include Huntington's disease, a genetic disorder causing progressive brain degeneration, and Wernicke-Korsakoff syndrome, often related to chronic alcohol misuse and vitamin B1 deficiency. Delirium, by contrast, is a sudden, temporary state of confusion, a disturbance in attention and awareness that develops over a short period, often triggered by infection, which can disrupt brain function and lead to acute confusion. Medication or dehydration. These factors can quickly alter a patient's mental state. Delirium is a medical emergency. Prompt recognition and intervention are crucial. Treat the cause and symptoms usually resolve. Addressing the underlying issue is key to restoring cognitive function. Depression in older adults can mimic dementia, sometimes making it challenging to distinguish between the two, causing memory and concentration problems, impacting their ability to perform daily tasks and engage in social activities, but is often reversible with treatment. With appropriate interventions such as therapy and medication, individuals can experience significant improvement. Don't dismiss depression as just aging. It's a misconception that can prevent individuals from receiving the care they need. It's treatable. Effective treatments are available to alleviate symptoms and improve quality of life. Alzheimer's disease, a form of dementia, is a specific neurodegenerative disorder. It is marked by slow, progressive memory loss due to brain changes. These changes disrupt neuronal function and lead to cognitive decline. Remember, dementia is chronic and progressive. Its effects worsen over time. Delirium is acute and reversible. Addressing the underlying cause can lead to a full recovery. Depression can look like dementia but improves with care. With the right support and treatment, individuals can regain their cognitive abilities and emotional well-being. Recognizing these differences is crucial for safe, effective nursing. It allows us to tailor our interventions to meet the specific needs of each patient. And for NCLEX success, a solid understanding of these conditions is essential for passing your nursing exams. Always assess for underlying causes and treatable conditions. A thorough evaluation is the first step in providing appropriate care. Early identification leads to better outcomes. The sooner we recognize and address these conditions, the greater the chance of improving the patient's well-being. Your role: see the whole person. Consider their physical, emotional, and social needs, not just the symptoms. A holistic approach ensures that we provide comprehensive and compassionate care. Let's move on to managing challenging behaviors like sundowning, a common phenomenon in individuals with dementia. Sundowning is increased confusion and agitation in people with dementia as evening approaches. It's not a disease, but a pattern. Fatigue, low light, and changes in routine can trigger it. Symptoms include restlessness, anxiety, aggression, and trouble sleeping. Management starts with non-drug strategies. Keep routines consistent, reduce noise, use soft lighting, and play calming music. Address physical needs. Pain, hunger, or infection can worsen symptoms. Medications are a last resort due to side effects. Use only if non-drug methods fail, and always with caution. Your goal: create a safe, calm environment and support both patient and caregivers. Let's look at broader treatment strategies for these conditions. Managing dementia, delirium, and depression in older adults requires a comprehensive and thoughtful approach. It's about understanding the nuances of each condition and tailoring interventions to meet individual needs. Effective management requires both medication and supportive care, working in tandem to provide the best possible outcome for the patient. For Alzheimer's disease, drugs like donepezil or memantine are often prescribed to help manage cognitive symptoms. These medications may slow the progression of symptoms, offering some relief, but it's important to remember that they can't cure the disease. The real cornerstone of care for Alzheimer's and related dementias is non-drug care. This includes creating safe environments, establishing predictable routines, and incorporating therapies like music therapy or reminiscence therapy, which can be incredibly beneficial. When addressing delirium, the first step is to identify and treat the underlying cause. This might involve administering antibiotics for an infection, providing fluids for dehydration, or carefully stopping any medications that may be contributing to the delirium. It's also crucial to keep the environment calm and familiar to reduce confusion and anxiety, and avoid the use of physical restraints whenever possible. Depression in older adults is often effectively treated with SSRIs and various forms of therapy. Cholinesterase inhibitors are commonly used to manage symptoms of Alzheimer's disease. Examples include donepezil, rivastigmine, and galantamine. These medications help improve communication between nerve cells and may slow symptom progression. In severe dementia, incontinence is common. To help establish regular toileting schedules, use absorbent products, and maintain skin hygiene to prevent breakdown and infection. Prompt cleaning and barrier creams are essential for skin care. Caregiver burden is a significant issue. Caregivers may experience stress, fatigue, and emotional strain. Support groups, respite care, and counseling can help reduce this burden and improve quality of life for both patients and caregivers. Nursing alert: tricyclic antidepressants should not be prescribed for aging adults due to their anticholinergic effects, which can cause confusion, constipation, and urinary incontinence. In particular, Cognitive behavioral therapy and strong social support networks are especially effective in improving mood and overall well-being. Don't underestimate the power of encouraging regular physical activity and social engagement. These activities can significantly boost mood and cognitive function. It's vital to always tailor interventions to the individual's unique needs, preferences, and cultural background to ensure the most effective and respectful care. Remember, holistic care means addressing both physical and emotional health, recognizing the interconnectedness of these aspects. Your vigilance, empathy, and creativity in addressing these challenges can make a real and lasting difference in the lives of your patients. Next, let's discuss the sensitive topic of end-of-life care and the importance of providing support to families during these difficult times. Compassion, patience, and clear communication are absolutely essential in navigating these conversations. Let's explore how you can honor final wishes and provide comfort and dignity in the final stages of life. End-of-life care focuses on comfort, dignity, and honoring patient wishes. This is palliative care. Nurses facilitate conversations about goals of care and advocate for what matters most to the patient. Advanced directives like living wills and durable power of attorney guide care when patients can't speak for themselves. Know if your patient has these documents and respect their choices, including DNR or end orders. Clear documentation and communication prevent unwanted interventions. Support families who often face emotional and physical strain. Offer education, resources, and a listening ear. Recognize caregiver burnout and connect families with support services. Your empathy can ease suffering for both patients and loved ones. End-of-life care is about more than medicine, it's about compassion and respect. Now let's explore the changes that come with aging. Aging brings gradual changes to every body system. Stiffer arteries, weaker muscles, thinner skin, and reduced senses. Distinguish normal aging from disease. Adjust your assessments and communication accordingly. Vision and hearing loss are common. Use large print and speak clearly. Taste and smell changes can affect nutrition. Monitor for weight loss. Psychosocially, older adults face loss, retirement, and changing roles, which can lead to grief or loneliness. Many show resilience by finding new purpose and connections. Erikson's theory, late adulthood is about finding meaning and integrity. According to Erikson's theory, the stage for the geriatric population is integrity versus despair. In this stage, older adults reflect on their life and either achieve a sense of fulfillment and wisdom or experience regret and despair. Support healthy aging by encouraging social interaction and independence. Listen to life stories and validate experiences. This fosters dignity. Watch for depression or anxiety and advocate for mental health support. Holistic care nurtures body, mind, and spirit. Post-mortem care involves respecting the dignity of the deceased, providing privacy, and supporting the family. Nurses should follow facility protocols, prepare the body, and offer emotional support to loved ones. Clinical manifestations of a dying patient may include decreased appetite, changes in breathing, mottled skin, decreased consciousness, and loss of bladder or bowel control. Comfort care and family support are priorities. Euthanasia is a complex and sensitive topic. Passive euthanasia involves withdrawing life-saving interventions, allowing natural death. Active euthanasia involves actions that directly cause death. Nurses should not participate in active euthanasia or physician-assisted suicide. Mistreatment and abuse in the aging population can take many forms: physical abuse, financial abuse, abandonment, neglect, and sexual abuse. Nurses must be vigilant, report suspected abuse, and advocate for patient safety and dignity. Let's wrap up with your vital role in geriatric care. You've learned the essentials of geriatric nursing from the 4Ds to end-of-life care. This knowledge is your foundation for compassionate, skilled practice. Caring for older adults is a privilege. Your empathy and attention make a difference. Technical skills matter, but connection and communication define great nursing. Be an advocate, educator, and source of comfort. Small acts of kindness have a big impact. Break down complex topics, practice NCLEX questions, and believe in yourself. Nursing is a career of trust and responsibility. For more NCLEX tips and support, visit BRISPA International. Your journey is just beginning. We're here to help you succeed. Go forward with confidence and compassion. You are the future of nursing.